especially,
because Boger was considered an excess perpetrator.
and here he is here, and sat behind him here is Capesius as well, who is known as the druggist or the pharmacist of Auschwitz. And this is not a very good quality image, but I wanted to include it because I've been reading about this guy's behavior in the court. And at one point, the judge said to him, and he wasn't even on the stand at the time, about his behavior, because he was there. He'd gone in dark glasses, and he wore dark glasses for the entire thing. He was behaving a little bit like he thought he was a movie star, and he was laughing, he was joking throughout the entire thing. And if you think about the what is being spoken about, the survivors that are there, to say that this behavior was inappropriate is obviously, quite frankly, an understatement. And he was a pharmacist. He was a Romanian pharmacist, and according to an agreement with Romania and Nazi Germany, he joined the Waffen SS in 1943, and then in December 1943 he was transferred to Auschwitz, and he was working in the pharmacy there. So he was supplying the drugs for the medical experiments of Mengele. Mengele was his superior, and he worked with Mengele closely, and he was also working with Klaus Klauberg closely, another quite famous doctor that worked in Auschwitz. And at the trial, he was accused of several things. And he was, because of his Romanian and Hungarian affiliations, he was recognized quite often by some of the witnesses, the victims that had gone there. And one person, a witness called Nabel, had actually lived in the same house as him from 1935 to 1938. And she said, because he was trying to deny that he was on the ramp directing people left or right, sending them to their deaths. And she said, "Yeah, I know him. I used to live on the second floor. He was on the ground floor, and I saw him on the ramp. And he was the one that sent. He was one of the people that sent me one way." And then a survivor called Adrienne Kraus testified that she saw him wave his hand, and she went one way, and her father, her mother, and the sister were sent by Capesius to their deaths. And then there was one of the most interesting testimonies is a guy called Dr. Schlinger, and he knew Capesius, so he went up to him and he was like on the ramp, and he said, "Okay, so what's happening here?" And Capesius lies to him and says everything's going to be fine. And Dr. Schlinger does what I suppose all of us would do in this situation if you were with your wife and she wasn't completely healthy and you didn't know what this place was about or what was about to happen. He says to Capesius, "My wife is not completely healthy," and it's 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 just so tragic that obviously he thought he was doing the right thing for his wife, but you couldn't really have said a worse thing at that point. If you want your wife to have any chance of survival, you do not want to say that she's not completely healthy. And Capesius says, "Oh, she should go there then," very calmly, apparently. And that was the last time that he ever saw his wife, because she was taken and she was murdered straight away because she wasn't seen as useful. And there was another testimony is by this guy called Dr. Berner, who also knew Capesius, knew of. No, he'd done business with him before. I think he'd bought a pharmacy and an establishment off him, and Dr. Berner, arrived at Auschwitz, and it's just beyond imagination that he was there with his two twin daughters and an older, I think his twin daughters were about 9 years old, and then he was there with a 12-year-old daughter and his wife, and they'd arrived in Auschwitz, and he was talking to Capesius briefly, and he said, Captain, I have these two twin children that really need protection, because he was obviously, they were the youngest that he was with, so he was trying to get them protection first. And apparently Capesius said, and this is again like the guy that said, "Oh, my wife's ill," thinking that that's going to benefit her situation, telling these monsters that you have some twins when Mengele's about is obviously not a good thing to do. It's a it's a fate worse than death to have that sadistic individual use them as playthings for his warped experiments. So Capesius runs after these twins, and then he takes them to Mengele, and Mengele, for some reason, doesn't want them. Maybe he's got enough twins at this point. So Capesius, he brings them back, and he sends them to the line, which means their immediate death. But they're keeping Dr. Berner and quite a few of these other doctors because they think they might be useful. So he's sent the other way. And Dr. Capesius says to Berner that they're only going swimming. They'll be back in an hour. And then this is the last. Dr. Berner then sees his 38-year-old wife, his eldest daughter, who was 12 and a half years old, and his twins, Helga and Nora, who are 9.5 years old. He sees them for the last time go walk towards their deaths, although he didn't know it at that time, but that was obviously where they'd gone. Other crimes that Dr. Capesius is accused of, and this particular crime, there's 3 different witnesses. There's a guy called Dr. Kledzinski, and he was a Polish lung specialist who the Nazis had working for them in Auschwitz. And then there were Professor Dr. Fejkiel and another witness as well, that all said that he had taken part in the executed SS doctor, Dr. Roeder, some of his anesthesia experiments. So, and they all said that Capesius added a drug called Epivan to this coffee and then gave it to 4 prisoners, and that these prisoners drank it and 2 of them died. And what I thought was interesting when I was reading these court proceedings is the prosecution counsel actually says, unless we know about the dose, we can't determine the defendant's intent in this undertaking. Like, for me, that is murder. He's a pharmacist. He's put this crap in somebody's coffee without them knowing about it, and then he's got them to drink it and they've died. That's not manslaughter. That's straight up murder. And I thought it was interesting that the prosecution said that as well, like about, we don't know the dose, so we don't know if he meant to kill them or not. And then a couple of other things that he was accused of. The main things is that Capesius was a rapacious thief. So where he worked was the same place where that's Burger, so we'll save that, was the same place where the gold teeth were stored. So Capesius starts helping himself to this, and he starts sending suitcases. He also goes down to Canada, the section where all the victims' belongings are kept, and he'll help himself to, like, whatever he wants, basically. He'll go shopping down there. But mainly it's these gold teeth. And he's been seen by different witnesses with suitcases full of dentures that he sends these back home. And I just thought he was quite an interesting case, because he was a pharmacist, and we don't often think about these medical practitioners and their role in the perpetration of Auschwitz. He also would very cynically drive around in a Red Cross vehicle as well. Obviously, deception was key in Auschwitz, and he would supply the Zyklon B as well. So he was implicated a lot in the crimes in Auschwitz. Have you heard about this guy before, Michael?
Yes, I mean, I mentioned some of the books on the topic of the Auschwitz trial, and they all refer to Capesius. I think. What? How did you pronounce his name? I
Capesius
don't know I don't know what the correct pronunciation is. I thought it
or Capesius, I'm not
was
sure.
Capesius, but I could be wrong. I don't know. But yeah, they all refer to him and talk about his villainies, his malefactions in the camp. And I guess I would ask you where he would fall in this spectrum of perpetration, right? We were talking earlier about this notion of ordinary men versus, you know, ideological killers who are possessed with racial hatred. And
Yeah,
where do you see him on that spectrum?
I don't I don't see him as ideologically driven. Apparently, he was married to someone that was half Jewish, and if you look at his past and the things that he said, there was, and he wasn't a member like you mentioned earlier, like Mulcahy had been a member of like a Volkish movement before the war. He'd never been like politically aligned with any organization like that. I think he was quite clearly a careerist. He did quite well after the war as well, but he was a thief, a careerist. He likes the status. I don't think he really wanted it, and he kept on saying this. He didn't want to be transferred to Auschwitz in the first place. He was quite happy where he was, but when he got there, he realized how to take advantage of it. So I would say he was an absolutely ordinary
Yeah,
man
that's the impression. Yeah,
who,
that's the impression I have too. This is why we have to be so careful, right, when we're trying to grade the Holocaust and its perpetrators. There are some who really do fit this
yeah,
description of ordinary men. Certainly, the individuals that Browning talks about in his study of Reserve Police Battalion 101 really fit that description quite well. And I think Capesius probably does as well.
yeah,
Boger, not so much. Boger appears to have been a sadist.
yeah. So
Speak of the devil,
here he is.
literally.
Yeah. Well, he was called the Tiger of Auschwitz, wasn't he?